quite a profit. October, by the way, is Breast Cancer Awareness Month. It's a disease that can affect everyone, men and women. You probably know someone affected by it. It may be you. But our own Rob and me talk with Dr. Lisa Mastersons from TV's The Doctors about things that we can all do to live better now.
Dr. Masterson, let's talk about breast cancer and how many of us does it affect?
Well, it affects so many women, and we do have to make men more aware of it, even though it is much more rare in men than it is in women. It is about 200 times more of an incidence in women than it is in men. So it is so important that women, do their breast self-exam. They get mammograms. They go get their clinical breast exam by their doctor. And again, healthy living, eating right, decreasing alcohol, not smoking. It is so important for women to know the risk factors, and for men to also be aware of their bodies, to look for the same changes that we tell women to look for. Nipple changes, nipple discharge, skin changes, puckering, dimpling, lumps.
For a lot of us, we think, well, I'm going to go have my yearly checkup, and so they'll check me for breast cancer then.
Well, your clinical yearly checkup will be fine as far as that, but you also have to do your breast self-exam. So many of my patients will find their lumps on their own in between exams.
I'm sorry to read that. You had lost your mom to breast cancer, and you wrote about it in your new book, Paper Doll House.
Battling with that with my mother was very, very difficult, and I wanted to share that with people so that they could learn from that experience. As a doctor, I am going to go full force to try and combat breast cancer, and having that history with my mom, even more so.